Why does wound dehiscence occur during surgery recovery? Imagine your body as a team working together to heal after surgery. Sometimes, despite all efforts, the wound opens up again. This is what we call wound dehiscence. It might sound alarming, but understanding why it happens can help you stay alert and take steps to prevent it. Wound dehiscence happens when the forces pulling the wound apart are stronger than the healing tissues and stitches holding it together. Think of it like a rope that's been tied but then gets pulled too hard. Several factors can cause this. Infection is one of the biggest culprits. If bacteria get into the wound, they weaken the tissues and slow down healing. Signs of infection include redness, swelling, warmth, pain, pus, or a bad smell. Poor nutrition also plays a big role. Your body needs enough protein, vitamins, and minerals to rebuild tissue. If your diet is lacking, especially protein, your wounds may heal slowly or not at all. Conditions like diabetes or heart disease can reduce blood flow to the wound, making healing even harder. Smoking reduces oxygen and blood flow to tissues, which delays healing and raises the chance of the wound opening again. Obesity adds extra pressure on surgical wounds, especially in the belly area. The weight and strain can pull on the stitches. Also, anything that increases pressure inside your abdomen, like coughing, vomiting, or constipation, can cause the wound to reopen. The way your surgery was performed matters too. If stitches or staples are not placed correctly, or if the wound is closed under too much tension, the risk of dehiscence increases. Skilled surgeons aim to close wounds properly to avoid this. After surgery, activities that strain the wound can cause problems. Heavy lifting, sudden movements, or vigorous activity can pull the stitches apart. That's why doctors often advise avoiding strenuous tasks and supporting your wound with a special belt called an abdominal binder during recovery. Medications also influence healing. Long-term use of steroids can weaken your tissues and slow repair. Cancer treatments and some other drugs can have similar effects. You might notice your incision edges pulling apart or see the wound open where it was closed. There could be increased pain, swelling, or fluid leaking. Sometimes only the skin opens, but in serious cases, deeper layers and muscles can separate. That's a medical emergency and needs immediate attention. If you see tissue or organs through the opening, or if the wound is very open, seek help right away. For smaller openings, keeping the area clean and protected is important. Sometimes a binder can help support the wound. Deep or complete dehiscence usually requires surgical repair. To lower your chances of wound opening, follow your doctor's instructions carefully. Keep the wound clean, eat a balanced diet rich in protein, vitamins, and minerals, and avoid smoking. Be cautious with activities that put pressure on your wound. Managing chronic conditions like diabetes and high blood pressure before surgery can also help. If you notice symptoms like fever, increased pain, redness, swelling, or pus, contact your healthcare provider immediately. Early treatment of infections or other issues can prevent wound dehiscence. Remember, this complication occurs when the forces on a healing wound overcome the strength of the tissues and stitches. Infection, poor nutrition, chronic illnesses, obesity, increased pressure, surgical technique, and certain medications all contribute. Proper wound care, good nutrition, and following medical advice are your best tools to support healing and avoid this problem. If your wound starts to open, especially with severe symptoms, seek medical help without delay.